So today I will be unpacking indoor heat exposure as a determinant of health, and this is in the context of the changing climate in which we find ourselves. So basically, we know that we are living in a warming world, and this is because global warming will continue to increase in the near term, mainly due to continuing and increasing greenhouse gas emissions, for example, carbon dioxide. And this is true for nearly all of the climate scenarios of projected climates. With further warming, every region is expected to experience concurrent and multiple changes in climatic impact drivers. So, for example, there is significant evidence showing that heat waves will become more frequent, and the projections are able to show this with a high level of confidence. In addition to this, we can expect increases in hot extremes and decreases in cold extremes. So basically, what this means is that we'll be facing more hot days of more severity and fewer cold days. And what this image basically shows is that at a global warming of 2 degrees or above, these changes across all the regions become more significant. And of course, the situation begins to worsen as the warming is projected to increase to, for example, 3 degrees and 4 degrees. You can see here that the images are showing that the maximum daily temperature change will increase significantly in all of these scenarios. This is just to further reinforce the point of the accelerating temperature increases across Africa. So this image shows that the rate of temperature increases has indeed increased over recent decades. So for example, you can see here that the mean temperature difference from 1991 to 2021, and this is compared to 1900 to 2024. And the difference between the two periods has increased significantly over the years. And so this just shows then that the average temperatures are increasing year on year. So, of course, we know that extreme heat is a global public health crisis, and this is because heat waves are becoming commonplace across much of the world. While we know that natural weather and climate patterns, of course, play a role in these extreme events, there is, of course, also significant evidence to show that climate change is driven by human activities, which makes these events all the more common. And then we also have a lot of evidence that's been gathered globally to show that exposure to high temperatures, including heat waves, is the most significant direct risk of global warming that is caused by climate change. So around the world, we have seen temperature records being upended, and this is true for large parts of Africa, Asia, Europe, North America, where we are seeing increases in warnings of severe heat waves. I've just put together here a few examples just to show you of the urgency and the severity of the situation on a global scale. So, for example, in South America, there was a heat wave where temperatures soared above 40 degrees Celsius across large parts of Brazil, Paraguay, Bolivia, and Argentina. And most notably, this event occurred in late winter. And of course, we know that when we experience heat waves at times when people typically don't expect to experience them, then the health effects are more severe because physiologically the bodies have not had enough time to adapt to, to these higher temperatures. And so that is particularly concerning, the fact that now heat waves are beginning to occur during periods where they typically were not occurring and were not expected to occur, such as this event in Brazil that occurred in late winter. And what the evidence found was that climate change made this particular event 100 times more likely. And this was found by a scientific group called the World Weather Attribution. They produce a lot of evidence showing the direct links between Climate Change and Severe Events, and they are a very informative group to follow. So if you do have some time, I do urge you to follow that, the World Weather Attribution Group. Then we move on to the United States, where there was also a severe heat wave that was reported there. And then in the United States, the death certificates of more than 2,300 people who died in this heat wave in 2023 listed specifically exposure to excessive heat. And the reason why this is important is that the health impacts of extreme heat are really underreported. And they are often reported as, other causes. So, for example, cardiovascular events or respiratory events, but they're not necessarily noted on death certificates as exposure to extreme heat. And this is why, this in the US is maybe something that other countries should also take note of, because when we're able to provide specific evidence of the severity of the health impacts of heat, that's when people will begin to take notice that this is actually a real problem. It's causing deaths, it's really impacting health, and it needs to be addressed with the urgency that it certainly requires. We then move on to India. Between March and June, there were 110 people who died after suffering heat strokes, and these numbers were provided by the health ministry in India. Also, if we move on to England, in 2022, they experienced severe heat wave there as well, and there were about 4,500 deaths that were reportedly linked to this extreme weather event. So they experienced temperatures well over 40 degrees Celsius. And this is, very extreme temperatures for those parts of the world. Bringing it more to a local context, we have some examples of the serious consequences of heat waves in South Africa as well. But again, as I mentioned, there is underreporting of heat-related deaths and illnesses. And of course, this makes it difficult to accurately estimate the true health impacts of heat in South Africa. So, for example, in the Northern Cape, there were reports that an extreme heat event claimed the lives of 17 people. There was also a heat wave in the Northwest that was reportedly responsible for the deaths of 11 people. And of course, extreme heat doesn't only affect the public health, it also affects the ecosystem, and you'll see there a report of the impacts of extreme heat on ecosystem in terms of the killing off of species of birds and bats as well. So that brings us then to what is the link between climate change and indoor heat exposure? So there is a correlation between indoor and outdoor thermal environments because climate change-induced hot weather and extreme weather events then increase the risk of indoor overheating. And we know that people spend a significant amount of time indoors. This is particularly true for certain population groups, such as young children, the elderly, people with disabilities or limited mobility as well. High indoor temperatures have been shown to affect multiple aspects of human health. The strongest evidence suggests that the more severe impacts are related to respiratory health outcomes, diabetes, as well as mental health, in that there have been increases of schizophrenia and dementia symptoms that have been associated with exposure to extreme indoor temperatures. So what this is showing us then is painting a picture that people face serious health risks from exposure to high temperatures inside their own homes or in public or privately managed facilities, such as schools or health facilities or prisons or care homes. And so understanding heat exposure in all of these settings is really important to identifying effective and feasible short and long-term mitigation action plans, because of course, the only way you can develop these action plans is if you know what the impacts are. So we here in the Environmental Health Unit do a lot of work around trying to understand the exposure of heat to people indoors, and as well as trying to estimate the associated health risks. This was one of our studies in the Eastern Cape, where we monitored indoor temperatures in a number of homes. And we also, gathered information on the structure of the house because, of course, that also significantly impacts indoor temperature. So, for example, whether there's a ceiling, the type of floors, the ventilation that's available in the house, all of those things do impact indoor temperatures. And you'll see here in the plots that indoor temperatures were extremely high. They exceeded they exceeded 30 degrees Celsius, sometimes reaching up to 40 degrees Celsius in these homes. And the reason we use indices such as the heat index is because this provides what we call a real feel of temperature exposure, because it incorporates factors like humidity and wind speed, and it gives a more accurate representation of how the body physiologically is responding to the extreme heat. So you'll see here that these indoor temperatures are in the region of caution and extreme caution. So these are levels where we can, most likely expect to start seeing physical manifestations of exposure to heat. So heat cramps, heat exhaustion, heat stroke, dehydration, all of those sort of factors. Also, it's important to note that these plots also show that at some points, indoor temperature was even higher than outdoor temperature. And of course, the risk with this is that then, people get no respite from the heat, because if it's hot inside and it's hot outside, then you're just constantly exposed to this heat extremes, and sort of the cumulative exposure really does have quite severe impacts on health. We also conducted a similar study in Giani, in Limpopo, where we monitored temperatures in about 400 homes. And similar to the Eastern Cape, we also collected information about housing structures and other factors that could impact indoor temperatures as well. And so you will see here that there are plots for summer temperature, winter temperature, and spring apparent temperature. And you'll see there that in summer, the indoor apparent temperature goes as high as to the extreme danger caution level. And of course, that is very concerning. But for most of the summer period, the temperatures were within sort of the danger level, which again is very concerning. And of course, it's a similar situation in spring as well. And also, just to note that in winter, during the afternoon, the temperatures do also rise up to the extreme caution levels as well. And so what the picture that this is painting is that during most of the hours of the day in summer, indoor temperatures was classified within these bands of caution or extreme caution. And so, this means that people need to take actions to mitigate against these risks. So opening windows, cooler clothing, staying hydrated, those sorts of passive cooling mechanisms. We also looked at projections of the indoor apparent temperature, and we found that warming in winter in future climate scenarios was expected to be greater than warming in summer. And this ties up to the first two slides that I showed you, where there's evidence showing that we are going to be experiencing fewer cooler days. And so this just highlights the point that, we need to start developing um, more robust heat action plans because, of course, the situation, as the evidence is showing, is likely to worsen in the coming years. We also look at indoor temperatures in a number of public settings. So, for instance, schools and clinics. Today, I'll just be presenting on a bit about the temperature monitoring in clinics. So this was to understand the heat exposure in waiting rooms in clinics. And the study was again in Guyana. And the reason why this was particularly important is that a commonly cited problem in our public health sector is the duration of waiting times. And a previous study has shown that the average waiting time for patients, this is from arrival of the patient to the start of the consultation with the medical practitioner, was about 9 hours. So you can just imagine spending 9 hours in, very high temperature conditions, which impact health, really is very worrying. Also, another concerning factor is that obviously there are people who do go to these facilities with young children, babies, and to be sitting in this hot environment with a young child for 9 hours really it does raise concern. And so again here we use the apparent temperature thresholds to sort of understand what possible health impacts these apparent temperatures could have. And again, we are seeing here that the temperatures in these waiting rooms are within the extreme caution and the danger categories. And this means, again, there's the possibility of heat stroke, heat cramps, heat exhaustion, among other health impacts. In terms of some of our current studies that are looking at or actually collecting health measurements in relation to heat exposure, one of our studies is called HAPVIA. It's the Heat Adaptation Benefits for Vulnerable Groups in Africa. So HAPVIA is a longitudinal cohort study. We are conducting the study over a period of 4 years. We are now in our third year. So it is in Ghana and South Africa. We have two sites in Ghana and two in South Africa. And this is a consortium of a number of institutions. So it's led by the University of Cape Town and the SAMRC are partners, the University of Bristol, University of Ghana. We also work with a community organization called Slum Dwellers International, SDI, as well as SOARS. And so, in addition to collecting several physiological measurements, so this includes physical activity, we're monitoring physical activity, we're monitoring sleep, we're monitoring blood pressure, we're monitoring hydration status, as well as blood glucose. We are also looking at a number of mental health outcomes. And then we have implemented an intervention, which is a reflective roof paint. So it's a passive cooling adaptation measure, essentially. We have implemented this intervention in all four sites across the two countries, and we're now in our post-intervention phase, where we are monitoring, where we're collecting health data to try and understand if the intervention, the roof painting, has actually had the impact on health that we would want, and also if it has had the reduction in temperature that we are hoping for. So these analyses are still underway, and they'll most likely be ready by the end of the year. And we would be really happy to share those findings as well. But just to show sort of the indoor heat exposures that we are seeing in in these two countries across the sites. So we'll start with Ghana. This is Gamashi. So Gamashi is in Accra. It's a coastal town in Ghana. And then we also have Nkwantekesi, which is a more rural town. And again, we calculated apparent temperature to sort of understand the possible health impacts. And you can see here that in Accra, the apparent temperatures are constantly between 40 and above 40 degrees. And this is obviously what is categorized as the danger zone in terms of health impacts. Oh, and just to mention that this is just focused on the summer months in both countries. So in Ghana, the hottest months of the year are February, March, and April. And so this shows that, during that summer period, the temperatures there are, extremely, extremely oppressive. It's the same for Nkwantekesi, although Nkwantekesi does get a bit lower because it's a more rural area. It does have a lot more greenery as well, whereas in Accra, it's a very built-up area. For those of you who, maybe have been there, you would know that Gamashi in particular is a very built-up area, very concrete, not much greenery, and of course, we do know that the microclimates in which the homes are does have an impact on the indoor heat exposure, and we are also both have a paper that we're working on now that's been actually submitted, where we are looking at understanding the impacts of microclimates. We're trying to understand what the proportion of built-up environments, of green environments, what impact that has on indoor temperatures as well. And then in Veho, which is in Limpopo, the indoor apparent temperature varies there as well, but again, also really mostly within 35 degrees and above. So, again, very high temperatures, still within that extreme caution danger category of heat warnings. Khayelitsha is in the Western Cape. And the temperatures there are a little bit lower than the other three sites. And of course, this is just because of the climate of the Western Cape, but still relatively high in the summer period, above 30 degrees Celsius. And of course, as part of our study, we did recruit informal homes as well. And we do see that the indoor temperatures in these informal structures are significantly higher than in the more formal structures. So just some key points overall from my talk today is that climate change is already affecting health, and the impacts are expected to worsen and become more widespread in the years to come. And so understanding these impacts is critical in developing effective and region-specific evidence that will inform interventions, policies, and practices that protect health. Also, the consideration of indoor heat exposure in heat health warning systems or heat action plans is really something that should become a focal point. So, for example, working on determining appropriate triggers or recommendations for indoor temperatures that could guide health officials or communities to take the appropriate actions that mitigate the harmful effects to health caused by indoor overheating. Also, these warnings could enhance the preparedness of communities during hot weather conditions, and hopefully we'll then see a lower health burden of health outcomes that are attributed to these high temperature extremes. We also do need more evidence to build climate change resilience. For example, we need more data that supports decision making. So there are very few studies, for example, that are in South Africa that are monitoring heat exposure and associated health outcomes. And so we need to have more of these sort of long-running studies, long-running evidence that provides the information that we need to policymakers to be able to provide the recommendations for what can be done to protect people from extreme heat. Um, that brings me to the end of my talk for today. Thank you so much.